Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Dr. Urenna Jerry. You are a pharmacy resident, PharmD. You have graduated from the pharmacy school at Temple University, and you're doing a residency currently at TidalHealth Peninsula Regional. So thank you for coming on the program.
Thank you so much for having me here.
You are going to speak about drugs that are used to treat sexually transmitted infections. That's what we call them now, STIs. We no longer call them sexually transmitted diseases. So we'll use STIs from here on out because they are still a major problem in this country, aren't they?
Yes, they are.
I know we were talking before the program because I found a recent statistic summarizing that in the U.S. there's been more than 2.5 million cases of chlamydia, gonorrhea, and syphilis. That's 2019 data. But that unfortunately set a record for the 6th consecutive year in terms of the numbers of cases. So this problem is not going away, is it?
It's definitely not going away, but hopefully it goes away soon.
Well, what we're going to talk about first, I think you said you wanted to talk specifically about syphilis, HPV, and bacterial vaginosis.
Yes.
So let's start with syphilis. I think that's the one people know of the most. It's been around for quite a while. So talk to us about syphilis, what it is, what are the symptoms, and so forth.
Yes, so syphilis is a bacterial infection that is transmitted through a couple of ways. One, blood, body fluids, and also from mother to baby. So it's a disease of 4 stages. The primary stage is where patients or individuals see these symptoms. They see a lesion in the genital area or also in the mouth region as well. And if this is left untreated, or if patients or if individuals don't go to their doctors to complain about these lesions, it can disappear. But disappearing doesn't mean you're treated. Because what happens is the lesions will disappear after 2 to 4 weeks, but in about 8 weeks, you're going to get to the secondary stage, which presents as a rash. And I must also mention that these lesions are highly infectious. So when they have those lesions showing up, they can easily transmit the infections from one person to the other.
And that would be both vaginal intercourse and oral sex?
Yes. Because you can have these lesions in the genital area and also around the mouth as well. So the secondary stage presents as a rash. So you no longer have the regions particularly in the genital area, but you have this rash all over your body. And this rash is also highly infectious. So if you have sexual intercourse, when you have the rash, you can transmit the infection to your partner. Now again, the rash can disappear if left untreated. So it is very important when individuals are seeing all these symptoms to reach out to their primary care providers. If you leave the rash untreated, it will disappear, but then it transfers to the tertiary stage or the 3rd stage, where it can affect the heart, it can also affect the brain, and this is where people present with altered mental status, so confusion, or you start to see inflammation in some of the valves of the heart. So at this point, now and this can happen from 1 year or 2 years out from the first of the primary lesion that was in the genital area.
I know tertiary syphilis is one of the rule-out diagnoses when people are being evaluated for dementia or Alzheimer's. So this can be pretty serious if it gets to that stage, yet it can be fairly easy to treat, can it?
Yes, it is very easy to treat, especially in the primary stage. So when you see that or when you notice that lesion, you go to your primary care provider. There's a test that is done to confirm if you have syphilis. The treatment of choice is penicillin.
Penicillin, so simple, been around.
Yes, so simple, been around.
Now, is that usually by injection, intramuscular injection?
Yes, it is by injection, by intramuscular injection.
And that just one shot will do the trick?
Yes, for primary syphilis.
So what happens if that's missed and it goes on to the secondary stage with the rash? Is the treatment the same?
It's the same, but now you're treating for longer.
So catching syphilis in its first stage, reporting those sores, you just need 1 shot of penicillin. But if it goes away and then progresses where you have the secondary stage with the rash, you need more doses of penicillin?
Yes, you need 1 shot weekly times 3 doses.
Okay. So obviously it's better to catch this sooner than later, plus, reduce the transmission of it if you report it promptly and get treated, and then it's less likely to be transmitted to others, because this disease in particular does have those long-term consequences. So it's important. So let's talk now about HPV, or Human Papillomavirus, and that's gotten a lot of press of late, partly because we now have a vaccine for it. But tell us about what HPV is and what the symptoms are, and then we'll get into the treatments, and then of course the vaccine is a huge development in this area.
Yes, so the HPV, or the Human Papillomavirus, is a very tricky one because they say that about 100,000 sexually active individuals will have this virus at some point in their life, and they might not even know it. So it's typically asymptomatic, but that is why they recommend the pap smear. So to get the pap smear for ladies every 3 years to be able to identify the presence of this virus. So there are about 125 strains that are out there, but about 40 cause infections. And out of that 40, some of them cause cancers. So they can cause cervical cancers or also mouth cancers as well. So that is something to be aware of.
But no symptoms, no sores, no nothing. That's kind of scary, isn't it?
Yes, it can lead to genital warts, but it is usually asymptomatic.
So I guess that's why it's really important, all this press about getting the HPV vaccine. What age group is where it's optimal to do that vaccine or appropriate?
So the age group is 9 to 45 years in both men and women, and there are some vaccines that are specific for women, but the vaccine that you can use in both men and women is the Gardasil 9 vaccine.
So if one is not vaccinated and should develop HPV, what's the treatment for it?
So again, it depends on if they have the genital warts, but you should always use the vaccine. I recommend to get the vaccine in order to prevent even contacting the HPV virus.
Okay. But what about the treatment? Say someone's diagnosed with it on pap smear.
So sometimes we don't treat.
Okay.
Most of the times we don't treat. The doctors would recommend no treatment. But if they have to treat the individuals, we use this imiquimod cream, and that's the treatment of choice. But mostly we don't treat HPV virus. We just let it ride because it's asymptomatic.
But if it goes to vaginal wart stage, then the genital warts, then is that a treatment for that?
Yes.
The cream you're mentioning?
Yes, the cream I mentioned.
Okay. So I guess the bottom line is just get vaccinated.
Exactly.
And I guess this is part of the recommendations starting at the pediatrician's office level, I would assume.
Yes, hopefully that's what is happening. And again, if someone has an HPV infection in the past, you should definitely get the vaccine. You can still get the vaccine as long as you're within the age range of 9 to 45.
Okay. All right. Now, what about bacterial vaginosis? That's one I'm not that familiar with. So tell us about that.
Yes, bacterial vaginosis is a bacterial infection as well that is also sexually transmitted. And the major symptom this is seen mostly in females, but the major symptoms you see are a fishy odor, and you can also see thick vaginal discharge as well.
Does it have a particular color, or?
Yes, so they say it's white.
Okay.
But if once you start to have fishy odor, thick white vaginal discharge, definitely go out or reach out to your primary care provider.
Okay, and what's the treatment for that?
So the treatment for that is Metronidazole, also known as Flagyl. So that's the recommended treatment, one of the recommended treatment of
And
choice.
take that by mouth?
Yes, you take that by mouth for 7 days.
7 days course of treatment.
Yep.
Okay, well, and that usually takes care of it?
Yes, that usually takes care of it, hopefully. And then during this course of period, you shouldn't be or you should pause from sexual intercourse while getting treatment for bacterial vaginosis. There are also creams that we use, and I should also say this because this is very important. When you're using the cream or the intravaginal device, you should also abstain for sexual intercourse and also not use a latex condom because that can decrease its effectiveness.
Okay, and I know that's one of the things you wanted to talk about in our wrap-up is the importance of using protection when having sex.
Yes, the importance of using protection when having sexual intercourse, and also the HPV vaccine. It is very important. It prevents cancer, so that is why we're advocating for the use of the vaccines in men and women or between the ages of 9 to 45.
Let's just clarify with HPV, if you haven't gotten the vaccine, and you happen to be diagnosed with it, because you said most of the time there's no symptoms, and you get treated, does this mean you need pap smears more regularly?
So when you're first diagnosed with HPV, your provider will recommend that you get another pap smear within a year to see if the virus is still present.
And then once you get that pap smear in a year, then you're back to the every 3-year schedule. And of course, I would imagine there'll be some discussions about making sure you using protection and so forth.
Yes, exactly. So once you get that repeat pap smear and there's no virus present in your pap smear, then you go back to the 3-year schedule.
And of course, I imagine they would encourage the vaccine if they're in that age range, correct?
Exactly. They would encourage the vaccine in that age range.
Okay. Well, thank you for coming on the program and discussing, a complicated topic, but it is a problem in this country and important that we understand, what the symptoms are and if there are any and the importance of getting treated.
Thank you so much for having me here too.
And thank you for joining us for this edition of Focus on Health here on PAC 14.